going to perform the mouth, throat, and neck exam. First, we're going to start with the mouth. We're going to take a look at the patient's lips. They are nicely symmetrical, they are well perfused, and I don't see any evidence of lesions or cracks. Can you show us your teeth, please? His teeth are in excellent condition. He has all of his teeth, and I don't see any signs of decay. Now we take a look at your gums. So if you could just open up again. Great. The gums are in excellent condition. I see no lesions or open areas or erythema. Could you open your mouth wide for me? Great. I'm going to take a look at the buccal mucosa on both sides, and I see no lesions. All the skin is intact. It's nicely pink and moist. I'm looking at the hard palate down to the soft palate. I see the uvula, which is rising in the midline. I'm looking at the ventral, and if you could lift your tongue, dorsal surface of the tongue. I'm looking at the floor of the mouth, and I see no lesions. There's no wasting of the tongue. It's nice and pink and rough. And now we're going to look at the back of the throat. Can you just say ah for me? Ah. I see the uvula rising with the phonation of ah. And his tonsils are absent, which are very common for older adults. Even though he didn't get his tonsils taken out, that tissue can shrink over time and disappear. So it's not unusual. I also noted that the posterior pillars, which is where the tonsils would come out, were also nicely pink and moist. And now I'm going to have him stick his tongue out and move it side to side and up and down. Great. And could you say light, tight, dynamite?
Light, tight, dynamite.
Excellent. So this is all a negative exam for cranial nerve 12, which is the hypoglossal. Now we're going to move on to the neck. I see the neck muscles are nicely symmetrical. I don't see any wasting of these muscles here. Shoulders are also symmetrical. I see that his trachea is midline. The thyroid is located, the nodes of the thyroid are on either sides here with that little piece of isthmus which goes over the trachea. I see no nodules. I see no asymmetry, and I see no enlargement of that thyroid. And we do not palpate the thyroids as RNs. Now we're going to check all of the cervical lymph nodes. So we're going to start with the preauricular, which is in front of the ears. Then we go to the posterior auricular, which is behind the ears. And then to the occipital, which is just in the back of the head. The jugulo-digastric, which is at the base of the earlobe. The submandibular, submental. And then we go down to the neck. The superficial cervical starts starts at the top of the sternomastoid and then goes in front of the sternomastoid. The deep cervical is underneath the sternomastoid, so we're just going to go right down the middle of that. And then we do the posterior cervical, which is just behind the sternomastoid. Lastly, we're going to go on to the clavicle. So if you could just lift your shoulders, beautiful. So we're going to look for the supraclavicular, which are here, and the infraclavicular, which is directly under the clavicle. I did not find any. They were non-palpable, but if I were to find them, I would hope that they would be soft, non-tender, and mobile. Now we're going to move on to the range of motion of the neck. So the first thing I'm going to ask Mr. Moore to do is turn his head side to side. Very good. And now he's going to put his chin on his chest. And now he's going to look up at the ceiling. Very good. Now bring that down. Can you raise your shoulders up and down? Very good. Now we're going to do all of this against resistance. So I'm going to put my hand on the patient's cheek. And if you could just turn right towards me. And now could you turn towards this hand? Great. And then for the shoulders, I'm going to put my hands on his shoulders, and he's going to raise his shoulders against resistance. He had full range of motion. He had full strength against resistance. So this tells me that cranial nerve 11, the spinal accessory nerve, is intact. This concludes the mouth, neck, and throat.